Now, the hardest patients to treat, and don't get me wrong, we welcome patient input. Every doctor likes patient input because it helps you manage your patients better. But sometimes patients, those are muchisusa. So this is a list of the patients that are hardest to treat and hardest to work with. Number one, Google Doctors. Now, the invention of Google came with a lot of good things. Of course, it's an online library, it has everything. But then again, when it comes to the patient bit, the guys who do some little bit of research about their symptoms and then they come to you, Musawo, but then you know, you guys, I'm not saying Google is bad. You need to understand that we used to answer questions with Google in medical school and we would fail. So like you can't come with a Google response. We are going to treat you with cancer because Google always tells people they have cancer. You tell them I have pain in this, cancer. So someone comes to you, 20-year-old, they say, Musawo, those are nina cancer. Like, Obijewa. I was searching online and like, seriously? And then, okay, now Google was too big. Then there was this invention of AI. So with AI came all these things, ChatGPT, DeepSeek, what. Now patients no longer go to Google. They just go to ChatGPT. You know, it's very easy. You type in your symptoms, blah, 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 blah. It gives you a diagnosis. Then someone just comes to you with a diagnosis and they want you to write them medicine. Some people actually already know the medicine. They want you to distinguish which one works, which one doesn't work. Now, but you guys, do you think AI can replace medical school in these very few years it has existed? Guys used to write research things with ChatGPT and everything, and people would rubbish them. They would discredit your research. It'd be like, mm-mm. And I know it is going to come to that part yet. Like, it's relax. Huh? The third set are those guys who have friends in medical school. Actually, I want to combine this with the fourth set. The guys who have relatives in medical school. These ones make it very difficult. Even when you're managing them, you're working, but you're like under pressure. You're like, every word you say, every letter you write, they're going to judge you. They're going to scrutinize you because they have friends. Like, you guys need to understand that because you have friends in medical school doesn't mean you also went to medical school. Those are two different things. And it's worse for the guys who have relatives in medical schools. But over my son, over my daughter, my uncle, I know. Not yet. You know, I had a relative who was sick, and they called me one time to scrutinize what the doctor had written for them. Like, I was still in medical school, and they were telling me to scrutinize what a doctor had prescribed for them. This was my teacher. So I looked, I was like, okay, I just scrutinized, but like I was not even worthy to write that prescription. But look at the responsibility they had given me. Why do you guys make it hard for doctors to work? Like someone cannot work under that immense pressure. Like relax. If you have a relative or a friend in medical school or who went through medical school, like thank you very much. Thank you for teaching people. Now, there's a reason it's not him treating you. Now the last people are the most difficult to treat are the elites. The elites by definition, they have an Alasomioko, you have a Kasubaru, a few millions in your account, and you know some good English. The problem with elites is that they're always opinionated, if you know what I mean. You're like, opinions, like I told you, we welcome opinions from everyone, and you know it makes doctor-patient relationship smooth. But like you have to let people work. Let someone do their job. Now, I don't know. Someone talks to you and you're like, Oba mbiko bikole. Huh? Chichi. Like when I go to see a lawyer, I mention like a few words, I tell him, then I leave him to do the rest of these things because there's a reason he's an expert and I am not. I only chip in once in a while, when I am required to. Do you guys understand?